Watsonville Community Hospital is another step closer to being saved, thanks to a bill that's making its way to the California Assembly floor. KION's Lisa Principe explains how the Pajaro Valley Healthcare District plans to save one of the only two hospitals in Santa Cruz County.
In order to create a healthcare district, which would then become its own government entity, emergency legislation authored by Senator John Laird must first pass through the California Senate by February 14th, a very short timeline.
We only have two hospitals in Santa Cruz County. If we lose one, especially the one that serves our most vulnerable communities, it will have a severe, critical impact.
It's an effort to save Watsonville Community Hospital after the current owners, Housing Healthcare, filed for bankruptcy in December. Many rely on this hospital for care. It serves 50% Medi-Cal and 30% Medicare.
It is the hospital that serves our essential worker population, our farm workers, our folks who are, monolingual, non-English speakers.
The Pajaro Valley Healthcare District is currently the primary bidder for the hospital, but in order for that to happen, emergency legislation must pass through the state Senate to officially create the healthcare district. At that point, it would become its own government entity. Wednesday night, the bill SB 418 unanimously passed in the Assembly Local Government Committee and now goes to the Assembly floor and then hopefully to the Senate. The deadline to pass is February 14th.
If we don't have legislation passed by then, that's a key benchmark in bankruptcy, that the legislation moves ahead, we will not be a qualified bidder.
The urgency.
If the hospital closes, even for one day, the licensures, the certifications, all of those have to be started from scratch. It's expensive and it's time consuming. It's not easy. In that time, the nurses, the physicians, the other staff, they're all going to find other jobs. It will be nearly impossible to open the hospital again.
The hospital has been privately owned for over 20 years, but PVHD hopes to change that.
When there is private equity ownership, you have to make money, and you're also accountable to shareholders. In a public district hospital model, who you're accountable to is the community.
As part of this agreement, the current owners of this hospital have agreed to keep their doors open until March 31st to help give the healthcare district more time to take over. In Watsonville, Lisa Principe, KION News Channel 546.